Today we will be starting with a new unit or chapter, that is the respiratory system. Today we will be studying the pharmacology of cough. So let me explain what is cough. I hope everybody might have experienced what is cough. Okay, it is a protective reflex mechanism which will remove foreign material or excessive respiratory secretion. Now it is always involuntary reflex and major defense mechanism for our body. If any foreign body enters into your nose or respiratory tract, we respond it as a cough. Now there is no need to suppress a cough, but it will be a nuisance for others if you are in a meeting or in any other situations. Also, it might disturb a patient if cough occurs during rest or sleep. So cough is always a protective mechanism which prevent excessive respiratory secretion. Also it helps to remove a foreign body from the respiratory system. Coming to the mechanism of action of cough. If you look into the mechanism of action, the cough mechanism of action is a complex mechanism. It has a central and a peripheral nervous system involvement. Now, any changes in the bronchial smooth muscles and the bronchial mucosa will be responsible for the production of cough. The cough center is present in the medulla, and when there is a stretch in the receptors present in the pharynx, larynx and lungs, it stimulates the central receptor and the medulla, and the response will be a cough. The detailed mechanism of action here: if there is any irritation into the bronchial mucosa, it will cause bronchoconstriction of the muscles. This will lead to stimulation of the cough receptor, which will send cough receptor will be stimulated. So then afferent impulses will be sent to the medulla, that is where the cough center is present. From there, efferent impulses in the response of cough will go to the peripheral area by parasympathetic and the motor nerve to the diaphragm, intercostal muscles and lungs. These will cause contraction of the above mentioned diaphragm, intercostal muscles and the lungs, giving out a noisy respiration, which is otherwise called as a cough. So this is the mechanism of action of cough, that is any stretch irritation to the bronchial muscle mucosa, which will cause bronchial constriction. From here, the afferent will be sent to the cough center. Then from there, the cough center, medulla. From there, efferent through the parasympathetic and the motor fibers will be sent to the diaphragm, intercostal muscles and lungs. Here what happens is increased contraction, which is produced as a noisy respiration, that is the cough. Now, how many kinds of cough are there? There are two kinds of cough, that is productive cough and non-productive cough, which is otherwise known as dry cough. Productive cough, in productive cough there is expectorations, as we say kabam undavuna chamayana productive cough. Non-productive or dry cough is you feel your throat is irritated, itching feeling, and you just cough without any expectation. Kabam illatha chama, or dry feel thona chama, that is dry cough. Okay, depending upon the two types of cough, we have the management of cough. Okay, let's see the common causes of cough. Now, there can be upper or lower respiratory tract infection that can cause cough. Others include the allergic rhinitis, smoking, chronic bronchitis, pulmonary tuberculosis, that is TB, asthma. Some patients may experience gastroesophageal reflex may present as cough, pneumonia, congestive heart failure, bronchiectasis, and use of some drugs, that is ACE inhibitors. The main side effect of ACE inhibitors are brassy cough. Now, as I told you, mentioned in the last cause, use of ACE inhibitors can cause cough. So, what are the other drugs that can induce cough? ACE, nothing but angiotensin convertase enzyme inhibitors like captopril, lisinopril, etc. can cause cough. Amiodarone, iodine and beta blockers. These are the other drugs that can cause cough. Just understand the names. When you study these drugs in detail, you will be studying about cough also. Okay, few terminologies that you should study under this topic, that is antitussives, expectorants, mucolytic and mucokinetic. I hope you might have heard about antitussives. Antitussives are nothing but cough suppressants, that is agents that are used to suppress the cough. Expectorants are those drugs or agents that help to increase the volume of mucus secretion. Some people will tell you, oh, kapam undu പക്ഷെ കുറുകിയിരിക്കുകയാണ്, അതങ്ങോട്ട് ഇളകുന്നില്ല. So in case you can increase the volume of mucus secretion, expectorant. Mucolytic is nothing but to reduce the viscosity of the mucus. As I told you earlier, കഫം കുറുകിയിരിക്കുന്ന കഫത്തിൻ്റെ കുറുക്കൽ മാറ്റുന്നതാണ്, or reducing the viscosity of the mucus is nothing but mucolytic. And mucokinetic is to increase the mobility of cough. It also helps to pull out the mucus outside the body also. Some it stays at the throat only, it is not coming out. So mucolytic and mucokinetic help to spit out the mucus also. Coming to the classification of drugs used for the treatment of cough. First, antitussives, mucolytics, expectorants and others. These are the 4 groups of drugs that you will study under the treatment of cough. Coming to antitussives. Antitussives, I mentioned earlier the term, it is that nothing but cough suppressants. So there are 2 mechanisms of acting, that is centrally acting antitussives and peripherally acting. Central, whenever you hear central, it is always that the action takes place at the brain. Under centrally acting, there are opioid mechanism initiating antitussives and non-opioid mechanism initiating antitussives. Under opioid mechanism, it is codeine and polcodeine. Non-opioid mechanism, it is Noscapine and Dextromethorphan. Nowadays, opioid mechanism antitussives are lesser available, while non-opioid mechanism drugs like Dextromethorphan are available more commonly. Second one, peripherally acting antitussives includes pharyngeal demulcents, syrups, lozenges and steam inhalation. Pharyngeal demulcents includes those which helps to soothe your larynx, that irritation, prevent the irritation, peripherally preventing the irritation. Okay, so under antitussives there are centrally acting and peripherally acting. Centrally acting, they are divided to opioid and non-opioid, and peripherally acting pharyngeal demulcents, which includes syrups and lozenges plus steam inhalation. Under steam inhalation, you take നമ്മൾ പറയില്ലേ ആവി പിടിക്കുക, they help to evacuate or expel out the mucus which is very thick from the body. They help to expel out these things if mucus is present. If mucus is not present, they help to soothe the throat and the respiratory tract. Okay. Second, as I told you, expectorants. Expectorants, there also it is divided into 2: directly acting, indirectly acting. Under directly acting, guanafensin and sodium citrate. Indirectly acting, it is ipecac and ammonium salt. Under mucolytic, the drug includes bromhexin, ambroxol, acetylcysteine and methylcysteine, and others includes antihistamines for allergic reaction, bronchodilator if asthma is there, and local anesthetic if there is harsh pain in the throat. Okay, these are the other drugs which are used for the treatment of cough. As I told you, first one is antitussive, second is expectorants, which is further divided into directly and indirectly acting. Third is a mucolytic. I told you mucolytic, you should remember, increasing the viscosity of the mucus, and others which includes antihistamines, bronchodilators and local anesthetics. Coming to antitussives, the antitussives, what we usually say, a cough should not be suppressed until and unless we treat the underlying cause. The cough will just go off. So here, when it is a disturbance for the patient, we try to suppress the cough. The drug which suppresses the cough is known as antitussives. How it acts? It raises the threshold of cough center in the medulla. In the respiratory tract, it reduces the tussle impulse, and it is helpful in the dry cough, or useful for dry cough. When there is no expectorations, we can use antitussives just to suppress the cough. The first drug under antitussives include codeine. They are semi-synthetic under opioid mechanism. They are semi-synthetic opioid analgesic, less potent than morphine. It is more selective for cough center. Potent cough suppressant action at a very low dose. Antitussive action which can be blocked by naloxone, which is the antidote for opioids, and also has lesser addiction. Now the only side effects includes constipation, drowsiness, respiratory depression, contraindicated in bronchial asthma. Coming to the next drug, polcodeine. another antitussive with similar efficacy to codeine. It has no analgesic or addictive effect. Longer acting and is given at a dose of 10 to 50 milligram thrice a day. So these are the two drugs which come under opioid mechanism. Coming to Noscapine, this also is an opium alkaloid which belongs to benzyl isoquinoline groups. It also has no addictive, no analgesic or constipating property as the first one, codeine, has. It does not interfere with the mucocillary movement, and it has a very different mechanism. It releases histamine. The side effects includes nausea, headache, tremor and bronchoconstriction. The dose is about 50 milligram which is being given. But this is not used nowadays. We usually use codeine or polcodeine, but codeine as well as polcodeines are being restricted nowadays by the FDA. Coming to dextromethorphan. Dextromethorphan is a D-isomer of methorphan. It raises the threshold for cough reflex, and it has an antitussive action which is not blocked by naloxone. Naloxone is an antagonist for opioid drugs. This drug, dextromethorphan, is not blocked by naloxone. Now, if you ask me the mechanism of action of dextromethorphan, it is an NMDA receptor antagonist which will have which has a very least addiction and constipating action with minimal drowsiness. The other drugs, that is the opioid drugs, will have drowsiness. Now here there is no analgesic action, no effect on the mucocillary actions also. Its use is usually for along with antitussives, antihistamines and a bronchodilator. It can be used as a cough suppressant. Now the side effects includes nausea, vomiting, ataxia, as well as the dose is 10 milligram thrice a day. Coming to pharyngeal demulcents, that is the peripherally acting antitussives. Demulcents, sore throat, usually given for sore throat. These gives a soothing effects to the pharyngeal laryngeal mucosa and helps in the symptomatic relief in dry cough. The dosage forms includes either syrups or lozenges. We have strepsils. Strepsils acts as pharyngeal demulcents. They soothe and I hope you have seen the advertisement. They usually soothe and the irritating cough. That is, a layer is being formed in the advertisement. You can see a layer is being formed over the laryngeal or pharynx, help in prevention of irritation to the pharyngeal mucosa and thus preventing cough. Coming to the expectorants, expectorare, dry from the chest, helps to pull out the mucus from the chest and expel it out also. Okay, increases mucus secretion and decreases. This also facilitates the decrease in viscosity and increase in bronchial secretion. Also helps in removal of the mucus from the lungs. So there are two types, directly and indirectly acting. Directly acting is guanafensin, sodium and potassium citrate or acetate. Then reflex acting ones include ammonium salt and potassium iodide. Now here I will just explain what is important. Guanafensin is important. I'll go in detail with guanafensin. This is just a rough summary of what is sodium and potassium, how sodium and potassium citrate or acetate acts. Their mechanism of action will be bronchial secretion by reducing the increasing the bronchial secretion, expelling out by salt action. Guanafensin acts as expectorant, which is a drug which is usually taken out by the mouth. Increases the mechanism of action is it increases the airway secretion and the mucocillary activity. The dose will be 100 to 200 milligram BD or twice a day. Now ammonium chloride EpiCac, here reflexly it will increase the bronchial secretion and acts as a gastric irritant and suppresses the cough. Potassium iodide acts both directly as well as indirectly. Liquefaction of tenacious sputum, that is, thick mucus will be liquefied. Adverse effects includes the metallic taste, swelling of the salivary and lacrimal gland. Sometimes it might cause hypothyroidism, and the dose which is being given is 300 milligram TDS. Coming to mucolytics. Under mucolytics, the main drug you should remember is acetylcysteine. Acetylcysteine helps to reduce the viscosity of the sputum by opening disulfide bonds of the mucoprotein. This is the biochemistry, how they reduce the viscosity. The side effects will be nausea, vomiting, stomatitis. Some patients may experience bronchospasm and rhinorrhea. The dose is 200 milligram and they administer directly to the respiratory tract. It can be given orally also. Bromhexin, another derivative of acicin that or Vasaka. Here what happens is depolymerization of the mucopolysaccharide, which increases the lysosomal activity, helps to increase the volume and decrease the viscosity of the sputum, as well as they help out to expel out the sputum. The side effects will be GIT absent, rhinorrhea and lacrimation. This is useful in patients where mucus plug present, tracheostomy, emphysema and CF, cystic fibrosis. The dose is 30 mg TDS. Now bromhexin, the other acetylcysteine. All these are useful in productive cough. Nammal antitussive is the one which was used for dry cough. Now expectorants, mucolytics, both these are useful in productive cough. Coming to ambroxol, another metabolites of bromhexin, similar property where the dose is only 15 to 30 mg TDS. No need of the next one, a little more higher grade, which is useful only in cystic fibrosis. Okay, ambroxol, which is a metabolite of bromhexin, just study ambroxol. Coming to the other groups of drug that helps in the treatment of cough. First one, if it is allergic rhinitis, we go for an antihistamines. These are added to antitussives or expectorant formulation, which will help in the relief of cough due to sedative and anticholinergic actions. It lacks specificity for cough center, but it has an additive effect, helps the antitussives to prevent the allergic reaction, thereby irritation of the mucosa will be prevented. Now it has no expectorant action, decreases secretion, suitable for allergic cough but not for asthma. Example includes chlorpheniramine, diphenhydramine and promethazine. These are the antihistamines which you will be more familiar when you study the chapter antihistamines. So antihistamines can be added to antitussives. So these both action can prevent dry cough. Coming to bronchodilators, those patients who has asthma can also experience cough. This is due to bronchospasm. So bronchospasm will aggravate cough. So addition of a bronchodilator will help to prevent the action of cough. It is treating the cause and then additive action along with the other agents that prevent cough. So the mechanism of action will be increasing the surface velocity of airflow through the during cough and clear the secretion of airway. This is not used routinely for every type of cough, and it is only used when there is bronchospasm, usually when there is bronchial asthma. Especially the agents used are beta-2 agonist. I hope you remember beta-2 agonist, salbutamol and terbutaline. Under the adrenergic chapter we have studied beta-2 agonist, salbutamol and terbutaline. Okay. Coming to local anesthetics. The local anesthetic, the main drug is lignocaine for intractable cough of bronchial carcinoma. The cause is bronchial carcinoma. Carcinoma can give to irritable, unpredictable, continuous cough. Okay. For such cases, we can give lignocaine, which will soothe in the pharyngeal area. This is usually administered as a nebulizer, and it helps to prevent cough during endoscopy also. Instilled topically in the airway. This will anesthetize the area and prevent the irritation, and hence helps in decreasing cough. The role of other agents mean role of hydration in cough. We always ask the patient to drink a lot of water, those who have cough. This will help to increase the viscosity of secretion. അതായത് കുറുകിയ കഫങ്ങളുള്ളവരടുത്ത് നമ്മൾ നല്ല വെള്ളം കുടിക്കാൻ പറയുന്നതെന്ന് വെച്ചാൽ ആ കുറുകിയത് വെള്ളം പോലെ ആകാൻ. Apart from the drugs, we should also ask them to have water also. Not that if you have cough, just have water, the cough will go. No, you should give that drug for cough also. Plus you should tell the other roles of these normally done procedures, like have lots of water. Now adequate fluid will decrease viscosity and it is very highly effective. Now what is the role of steam inhalation? It helps in useful for liquefaction of tenacious sputum. അതായത് കുറുകിയ കഫങ്ങളെ viscosity കുറയ്ക്കുന്നു or liquefying sputum. Okay, the steam inhalation helps to liquefy the tenacious sputum, and also helps to spit out. When it viscosity is decreased, then it helps to come out. It helps in coming. It naturally comes out of your body when you cough. Now, specific treatment approach to cough. Now, how do you treat? Suppose if you have a upper or lower respiratory tract infection, you should specifically give antibiotics. That will itself decrease the cough. Then you should give the supportive drugs for cough. If it is expectorant productive, either expectorants or mucolitis. If the smoking or chronic bronchitis, smoking is the reason, quit smoking and then give the additional treatment for productive cough. Under pulmonary tuberculosis, the main cause will be the TB. So for that you should give anti-tubercular drug. Asthmatic cough, you should give beta-2 agonist, inhaled beta-2 agonist, or ipratropium or corticosteroids. If there is a postnasal drip under sinusitis, a very common condition where you experience head heaviness and a postnasal drip. Here you should give antibiotics to reduce the infection in the sinus, nasal decongestants to open the nasal cavity, and antihistamines to prevent the postnasal drip, plus the other cough suppressants to reduce the cough. Gastroesophageal reflex, here you should give proton pump inhibitors and diet modification, and those agents which cause drugs which cause cough like ACE inhibitors should be changed and given with ARBs, that is low sartans. Thank you. So today we end up with the class Pharmacology of Cough. I hope all of you have understood the pharmacology of cough. Please write your name and roll number underneath for your attendance.